Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and this is another of our COVID conversations. Usually we have somebody else in public health joining us, and we're going to be able to do that on Monday when we're going to be talking about a really important subject that comes up seemingly every year, which is about wildfires and the risk to people and their lungs, especially when we have lots of wildfire smoke. But today we'll focus just on COVID, and there is quite a bit to talk about today. So in the world, COVID is quieting, although we're starting to see a few worrisome signs. South Africa is a place that we follow carefully. It has a very good public health system, and they do a good job in recording new variants. And as you remember, they were the first to pick up the BA1 Omicron variant, the BA2 Omicron subvariant, and they had first a peak with Omicron and then a smaller peak with BA2. And it turns out that most other places in the world are seeing a similar story. The thing that's worrisome there is that they've now noticed a little surge from BA4 and BA5, which are further Omicron subvariants. And the people who are getting this are people who were previously infected with Omicron, suggesting that infection with Omicron may not give good protection against these new subvariants. So for about 6 weeks now, we say there's no new worrisome subvariants out there. But now this week, I'll have to tell you that the BA4 and the BA5 are two subvariants that we're going to be following very, very carefully. In the rest of the world, however, Omicron and Covet are pretty quiet. The only place in the world now where I think there's some bit of unease is in mainland China. As you know, in mainland China has relied mostly on public health measures and the Chinese Comvax vaccine. This Comvax vaccine has not worked particularly well. And since they've not had a lot of disease in China, there are a lot of people in China who are susceptible to an Omicron infection. And so China is trying desperately to keep this from spreading. They're doing lockdowns in big cities. And given the contagiousness of Omicron, which is about 3 or 4 times more contagious than the original COVID virus, it's been really hard for them to do. So we'll see what happens in China. But in the rest of the world, things look like they're quieting. In Europe, where we've seen quite a bit of disease over the last 6 weeks, is beginning to quiet. And in the United States, we're still seeing a little bit of a BA2 spike, but the small BA2 spike is small, much, much smaller than the previous Omicron spike. In Oregon, we're still seeing a slight increase in the number of cases and a slight increase in the number of hospitalizations. This, we think, also is due almost entirely to the BA2 variant. Douglas County, we're seeing little spikes of cases, about 60 cases over the last week in comparison to about 30 in the weeks before. So a slight rise, but nothing like the 100 or 200 cases a day that we were getting in the beginning of January. Our hospitalizations remain low at less than 10. And the thing that's striking about the hospitalizations and the few deaths that we've had is that these are all coming among people who are not up to date on their vaccines. In fact, we went about 3 weeks with nobody in the hospital who was up to date on their vaccines. That's pretty remarkable. And so we're really encouraging people who are not vaccinated to get vaccinated. If you are vaccinated and need a booster, please get a booster. And if you've had a booster and it's more than 4 months, please get your second booster. Recent data came out this week looking at the efficacy of that second booster. Not perfect, but it certainly decreased the risk of infection and decreased the risk of severe disease. So I got my second booster. I'm not looking to get severe disease from COVID, and I'm looking to get out and see people, visit my mom. And so with that, we're trying really hard to get people boosted, and if they're due for a second booster, get a second booster. We a couple of new things that have come out. They say this week that we're going to have a vaccine for kids for 6 months to 5 years. We've heard this before. I mean, we've been hearing this since October last, and so I'll believe it when I see it. Still have not seen the actual data, number of kids, what really happened with these kids in looking at this. So when the vaccine for the younger age group comes out, we'll let you know. Other things that came out this week is a very nicely done study that looked at the risk of contracting COVID from airborne exposure versus environmental substances. So you remember early on, we had this flurry of people washing everything down and washing down streets. And at the beginning, we said that probably is not going to prevent much disease. And indeed, the study came out today, said it was 1,000 times more likely to catch COVID from airborne transmission than it was from environmental surfaces. And so that is not surprising to anybody else who looked at the data. So I think we can kind of retire the relentless washing of surfaces for COVID. Now, for other diseases, washing of surfaces really does work. So for norovirus, which is this nasty GI virus, clearly cleaning surfaces does work. And for influenza, cleaning surfaces does work. For RSV, which is this virus that kids get, cleaning of surfaces does work. But for COVID, not so much, much more an airborne virus. The other things that have come out in the last few weeks is there's a new approved breath test for COVID. So this is a test where you'd blow in a tube like an alcohol breath test. It measures certain chemicals that are seen with COVID infection and is pretty accurate. It's about as accurate as the antigen test. So that's a great thing. And the other thing that we've been following since the beginning of the pandemic is wastewater COVID samples. So wastewater has COVID in it. And basically as people get COVID and they go to the bathroom, the COVID RNA is in the water, and you can concentrate that in the end and basically get an idea of how much disease is in the community. And you can look at that RNA and you can sequence it to see which of the variants are there. What we're seeing around the country is that the amount of COVID RNA in wastewater is fairly stable, suggesting that the amount of disease is stable, and it correlates with hotspots. So places that are having little spikes of disease have little spikes of increased RNA in their water, wastewater. So it's an amazing technique to follow, and I think in the future we'll be using this to follow other diseases that may be coming in society. But right now things are pretty quiet with COVID. Couple of other things that we wanted to talk about. One is the effective antiviral medications we have. We have several now. There are some oral antiviral pills called Paxlovid. These are excellent, give about 90% protection against hospitalization and death. Easy to take, twice a day for 5 days. Not very many side effects. So we're saying that if you do get COVID now, whether or not you're vaccinated, you should talk to your doctor about whether you should take Paxlovid to reduce your risk of severe infection and hospitalization. There's an injectable form called bebtelovimab, which we do have here in town. That's useful for people who can't take Paxlovid for one reason or another. And then a third option is an IV antiviral drug called remdesivir, which you can get for 3 days IV. And that also reduces risk of hospitalization and severe disease by about 90%. So at this point, we really shouldn't have anybody more left in the hospital. Hopefully, most people we could prevent the disease with vaccination and boosting. For those people who still get disease, they could get one of the antiviral agents, and with one of those antiviral agents should not wind up in the hospital with COVID. And so we're getting to the point now where we have lots of tools that we didn't have in the beginning. So in the beginning, when COVID started, we had nothing. We had no antiviral meds. We didn't have good in-hospital treatments. And so in the beginning, we had to rely on what we had, which were public health measures, lockdowns, and closures. However, now that we have vaccines, antiviral medications, better hospital treatment, I think at this point, releasing the public health measures makes sense because we have so many other ways to protect ourselves. So our best advice at this point is still be careful. There's still a little bit of disease out there, but people should carry on with their lives. And when they carry on with their lives, they should still be careful that if they're sick, they should stay home from work. If you're well, though, and you're around people who are well, go in and enjoy yourselves. Please get vaccinated. If you're due for a booster, get a booster. If you're due for a second booster, get a second booster. And if you do happen to come down with symptoms of COVID, please get a test. If you're positive and in a high-risk group, talk to your doctor about getting one of the very effective antiviral medications so that if you got COVID, you might get sick, but we really don't want you winding up in the hospital or dying from this. That's what we got for COVID. Next week on Monday, we're going to be talking with somebody about wildfire prevention. And wildfires are a big concern. I know it's raining this whole month, and so that will decrease our risk in the next few weeks. But we know that come summer, it's going to get windy, it's going to get dry. And when it gets windy and dry in Western Oregon, we're certainly at risk for fires. So we'll talk to somebody on Monday about wildfire protection. But for today, this is what we have for COVID. Again, I'm Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Thanks so much.